you will not experience, everyone is different. You might experience 1 or 2 or 3 of these symptoms, others might experience all the symptoms. And some people don't just be looking out for just chest pain, because I've spoken with some people and they always say, oh, when they are having this tightness, heaviness in their chest, then they know it's heart attack. You might not even experience this chest pain. So it can be one or the other, or any of it. So when you experience all that, as I always say, you go, you get yourself checked. If it's not associated with a heart attack, it might be something else which they will diagnose you with and you get the treatment with. But then if you sit at home, you don't go for help, then you, in terms of, as I said, time is essential in getting treatment for heart attack. If you sit at home, then your heart will be damaged. The muscles of your heart will damage, which will cause more complications. So when you have all these symptoms, please try and seek for help. So if we know what heart attack is, if you know what the symptoms are, what causes heart attack? What are the causes of heart attack? So there are a lot of things that can cause heart attack. But if you are someone who has a heart disease, what we call the coronary heart disease, that's in short form, you hear people saying CHD, you are more likely of having heart attack in your lifetime. So if you have any heart issues, any heart problem, which you are getting treatment with, as you are of at least a high risk of you developing heart attack in your lifetime. Also, what can cause your heart attack? Smoking. If you smoke a lot, it is also a cause of someone having heart attack. If your diet is always has high fat diet, you always have high fat diet, which can increase your cholesterol. So every food you when we discuss, we said some people like fatty food, it can increase your cholesterol. So someone who smokes, cholesterol, someone who has diabetes, high blood pressure, it can cause a heart attack. People who are obese or overweight, people who do lack of exercise. If you need to exercise, I always say it's one of the, if you don't, I'm not saying now, I know now that we are in the new year, we'll get all these offers asking us, because we've enjoyed our Christmas celebration, we've enjoyed our New Year celebration, you've overate, you've eaten all the food that you were maybe not supposed to have eaten. You get all these offers saying come and sign up with the gym and all. You don't need to, if you don't want to go to the gym. Yes, if you go to the gym, it's very good. I'm not saying you shouldn't. It's very good. If you are someone who can go to the gym, it's very good. But if you can't, due to maybe your daily activities, there are lots of things that you can do to exercise. To exercise, you can walk, you can swim, you can use the stairs, climbing the stairs, you can cycle. All those things can help you, because these are some of the causes. Overweight, lack of exercise. Maybe you might think, oh, for me, I'm size 12. For me, I'm size 14. For me, so because of that, I don't need exercise. But the fats in your body needs to be burnt. So even though you look slim, you might be having high cholesterol. So in exercising, it will burn some of those fats. And also people, the cause is thrombosis. So there are some people who have DVTs. As I defined what heart attack was when the supply of blood to the heart is blocked, usually by blood clots. So if you are someone that's you have DVTs or blood clots problems, you have a high, chance of you developing heart attack in your lifetime. So these are some of the causes. So then there are some less common causes, which are drug misuse. drug misuse. So some people misuse drugs. They are one of the drugs that I will mention is those people who use cocaine. Because when you use cocaine, it restricts your heart, the supply of blood to your heart. And when it does that, it's the supply to your blood reduces, and you end up having heart attack. And there's a study that was done by British Foundation who found out that in young people, the most common, heart attack death in young people who were using cocaine. So not only cocaine, if you misuse other drugs, you have to be very careful, because some medications, if you misuse it, can restrict the supply of your blood to your heart, which can cause you having blood attack. And also lack of oxygen in the blood. So we know what a heart attack is. We know what the symptoms is. We know what the causes of a heart attack is. So how do we diagnose heart attack? How do we diagnose heart attack? So as I said, heart attack is today, the topic, those who have just joined me on ABL television, I just want you to do, I'm talking about heart attack today. And when starting, I wish all my viewers a happy new year. And I hope our Christmas and celebration and our New Year celebration went well and we all stay safe. So please don't forget to subscribe, to share, to comment, and to invite others to also come and listen to what I'm discussing today, which is heart attack. And as I discussed earlier on, when I started, I said heart attack is when the supply of blood to our heart is interrupted or is stopped or restricted by a blood clot, and lack of blood supply to our heart causes our muscles, the heart muscles, to weaken, and which is a life-threatening situation. So when you or any of your friend or loved one have the symptoms that I've mentioned before, then you need to call 999 and ask for ambulance, so that help will be given. You will get the help that you need, because heart attack is one of the major medical emergencies, which time is very essential. Time is because the earlier you seek help depends on the treatment you get, depends on how early you seek help for. So knowing what heart attack means, knowing the symptoms which I've mentioned, several of the symptoms, which is chest pains, tightness of your chest, wheeziness, coughing, feeling sick, feeling vomiting, weak. Sometimes the pain, you get the pain from your chest that moves through your part of your body, your neck, your jaw. Some people even feel the pain. Normally they say, oh, left pain. It can also move to the other side, but most of the time you feel the pains around your left part of your body. So these are some of the symptoms. And then I said sweaty, you feel sweaty, shortness of breath, and anxiety, panic attack. So if you experience any of these symptoms, then you need to seek help, and you don't need to go to your doctor. You don't need to go to your GP. You have to go find your way and go straight to A&E. So if the ambulance will be the quickest, you dial 999, then you go and ambulance will come for you, or you can drive your loved one to accident and emergency if that's the quickest for you. And as I've mentioned, the causes which is the CHD, that is a coronary heart disease. If you are someone who has any heart disease problem, as I said, in your lifetime, it's likely that in your lifetime, you might experience heart attack. And I've mentioned several of the causes, which is smoking, diabetes, cholesterol, blood pressure, and then lack of exercise. Lack of exercise all causes heart attack. Then some misuse of drugs, which I mentioned earlier, and also lack of oxygen. So if we know what heart attack means, what the causes is, the symptoms, then how do we diagnose a heart attack? So if you, as I mentioned earlier on, if you notice any of these symptoms yourself, or you've noticed any of these symptoms in someone else, you have to call the ambulance. So once you are taken to accident and emergency, that's A&E, they will get a trace of your heart, which we normally call ECG. There'll be a trace of, because that will determine they'll be able to diagnose the type of heart attack, whether it's a mild heart attack or a severe one, and how severe the muscles of your heart has been damaged. So these tracing of your heart, so when you go, you see that they'll put some stickers on you, they'll put some cable, it's trying to trace your heart. So ECG is the best, that's the first thing they will do for you. Then there are other tests, such as blood tests. They also do X-ray, as well, chest X-ray, because as I was mentioning the symptoms, chest pain, chest tightness. So they need to also do a chest X-ray to see how damaged the muscles has been, and all will determine what treatment you'll be given. And also there's a scan we call the echocardiogram. Echo, in the short form, you hear them, do an echo. Also, there's a scan for the heart. All these are the how they will diagnose, the things that they can do in order to determine how severe your heart attack is and how far your muscles has been damaged, the heart muscles has been damaged. So if we know all the causes, how it's diagnosed, then the treatments. So as I was saying earlier on, when they do the ECG, the echo, which is the scan, the chest X-ray, then that's the diagnosis. Then they will know how extensive the heart attack has been. Then that is how they'll be able to treat you from this heart attack. So the treatments used all depends on the symptoms you've been having, the chest pain, the wheeziness, the coughing, the being sick, and all that. The treatment is depending on the symptoms that you have. So the first, we have what we call the PCI, which most of the time, if your symptoms started within the past 12 hours, then you'll be offered the primary precautious coronary intervention, which we call the PCI. So if your symptoms started within the past 12 hours, then you are likely to be given that PCI. But if your symptoms started within the past 12 hours, or if it started after the 12 hours, then they will be giving you some medication to prevent the blood clots. The blood clot. So the PCI, most of the time, the PCI is a combination of medicine to prevent the blood clots. So some of it can be injection, it can be tablets. Because as I was defining what the heart attack was, it's a blood clot that stops the blood flow of blood to your heart. So you will be given tablets to take to break down the clot, or to prevent the blood clot from forming in the blood. So there are four types of medicines that you'll be given. That is, you always hear beta blockers, statins, antiplatelets, then you ACE inhibitors. So they are all medication that either prevents blood clots from forming, or if you already develop a blood clot, it breaks down the blood clots. So if you yourself or someone that you know have already experienced a heart attack, there's there are a lot of help out there that will help you in recovery. And before you leave the hospital, most of the time you have a lot of multidisciplinary team that looks after you, the nurse, the physiotherapists, dietitians, pharmacists, the exercise specialists. All those healthcare professionals are there to support you, so you will not be alone. Before you leave the hospital or your loved one leave the hospital, you need to make sure that all these people have had their inputs, because there'll be a care plan for you, which they need to, when you go home, they will also get in contact with you. You can also get in contact with them. So as I said, we have the heart nurse specialist, the physiotherapist, who will be able to help you be able to try and be as you were before, mobile as you were before. So the most important thing that you have to know, that in your recovery, but it's not like you are going home and you'll be left alone. The most important thing, the two most important thing why you have all these people surrounding you, is to help you gradually get to your physical fitness, the way you were before you end up having a heart attack, and also to reduce the risk of you having another heart attack. Because as you've had a heart attack, the likelihood of you having it again is high. So these people are there to make sure that they support you in your recovery process. So please, when you are giving this care package, I know some people, they always want to be independent. You don't want to depend on people, but these are professionals who are there to support you. So don't go home without engaging. When you go home, then you stop engaging with them. Please try and engage with them. And we have the cardiac rehabilitation, which is the program whereby it starts in the hospital, because it's about your heart. Your heart. So as I said, the muscles of your heart can be weakened. It can damage. And so you need these people to be with you. There will be regular clinics that you need to be attending, appointments that you need to attend. So we have the cardiac rehabilitation team that will be following you up. Then exercise. We have the team, as I said, exercise specialists. We have them in the community. Some are based in the hospital, whereby they will give you some gradual exercise whereby you can be doing, example, like how to climb your stairs without getting tired, the bit by bit, and also some exercise that they will ask you to refrain from. Maybe you were somebody who were very active, going to the gym. Then if you experience heart attack, unfortunately for the nurse in your recovery position, they are there to guide you, to say, no, you going to the gym will not be good for you. You need to take it step by step. You're walking slowly, maybe swimming, using the stairs, and also they are there to help you in your recovery position. Then we have a team that will also help you in returning to work. So if you were working, depending on how severe your heart attack is, these people will be there to support you. There are some people within, 2 to 3 weeks, depending on how your job is. If your job is, light, it's not lifting and all that, within 2 to 3 weeks, depending on how well you are, some people are able to go back to work. But we have this team there who can help you to get back to your feet, to get back to your return to work with some precautions. I mean, they will the risk assessment, they will risk assess, they will also, so your line managers will also put things in place for you that you can go safely to work. But others too, depending on how severe the damage to your heart was, it all depends. Some people might not be able to return as soon as possible. They have to be at home for a while. Then and also research for British Foundation has also they did a research which they say that if you've had a heart attack, it does not affect your sex life. So you can, after 2 or 3 of between 2 to 4 weeks, you can go back having your sex without even affecting your heart. Driving, you don't need to inform DVLA that you've had a heart attack unless you have any other medical problems. So if you are diabetic and you develop a heart attack, then you need to inform DVLA. But if you have any other medical problem and you had a heart attack, you don't need to, inform them. But when you are driving, you have to be very cautious. Just at the back of your mind, you have to know that you've had a heart attack before, so you have to be very cautious and know what you're about. You don't need to inform them. And some people, a heart attack is a very frightening, and traumatic incident. So some people might end up having depression or anxiety, but your doctor is there, your practitioner is there, your GP is there. If you need a therapy, if you need help, you can contact your GP, can contact your doctor who can refer you, or you can also self-refer yourself, because as I said, it's a traumatic, a frightening and traumatic incident, and some people, it might depress them and they might not even be able to go back to work. So if you are such a person, don't suffer silence. Just see your doctor, see your GP, see your health practitioner who can refer you, or you can also self-refer yourself to get the help So having heart attack, there are some complications. As I said, it's about your heart. So after you've had a heart attack, there are some complications that some, depending on how fit you were, other medical health issue that you had, it can leave you with some complications. And some of these complications can be, you might end up having either a slow heart beat, or a fast heartbeat, or irregular heartbeat. So if you were normal and you develop heart attack, you might end up having a slow, fast, or irregular heartbeat. Some people as well, they end up having a heart problem, which is a heart failure, because it all depends on how severe the muscles of their hearts were damaged. You might end up having a heart failure, which heart failure is when your heart is unable to effectively pump blood into the muscles, into your body. So someone who had no heart problems, because of the heart attack, they might end up having a heart failure. Some of the other complications also can be a cardiogenic shock, which is a very severe one. It's almost similar to heart failure, but this is a very severe one. With the heart failure, your heart pumps blood is able to pump blood, but not ineffectively. But with a cardiogenetic shock, it can't pump blood at all. It's a very more serious one. And the symptoms can be mental confusion, cold hands and feet, decrease in when they want to pee, when they want to go and wee. There's a decrease. You can see now you have a decrease in weeing, peeing. It might be a sign. If you've already had a heart attack and you are experiencing these symptoms, it might be that you've gone into a cardiogenetic shock. You have pale skin, difficulty in breathing, rapid heartbeat and breathing, cold hands, place. It might be that you have had, after your heart attack, These are some of the complications. Then some people, they have heart rupture. Their hearts can rupture. That is, it is also a serious thing. So these are the complications that can come after you've had a heart attack. So now we know what a heart attack is, we know what the symptoms is, we know the complication that comes with it, and we know the causes. So how can we prevent heart attack? If we know all these things, we know it's a serious health condition. We know it's one of the emergency that when we see ourselves having all these symptoms, or someone that we know are having all these symptoms, they will need to dial 999 and ask for help. If we know that, how can we prevent it? Because that is the main purpose of this program. Health matters. Health is wealth, and wealth is health. Is for us to educate our viewers so that when you know all these things, you can make lifestyle changes to change the way you live your life, so that you don't develop these complications that we are talking about, these health conditions that we've been talking about. So what are some of these preventions? So some of these preventions are by eating healthy. Eating healthy. As I was mentioning the causes, these causes by, I say, cholesterol, diabetes. So it's by eating healthy. We need to eat healthy. We need to eat healthy by eating our vegetables, checking what we eat, not eating too much fatty food. Then also, if you smoke, you need to stop smoking. If you are finding it difficult to smoke, your health practitioner is there, your smoking cessation nurse is around, your GP is around, your doctor is around, or you can even self-refer yourself so that you can seek help, so you'll be able to stop smoking. You have to keep your blood pressure at a level that is low for you, which is normal for you. If you have a high blood pressure, you've been put on medication, please continue taking your medication. Yes, I know our traditional medications and all that are good. Continue taking those medications. You can take your traditional medications as well, but then you don't need to stop what your doctor has given you. Continue. When you go to your GP and your GP sees that your blood pressure is normal or is gone down, they will either reduce your medication or they will stop it. But don't stop. Don't listen to what others are saying. Then you will stop it. You need to keep your blood pressure at a normal level. And if you are someone who drinks alcohol, make sure you don't drink above the limits that you're supposed to, because these are the things that can prevent you from having a heart attack. Then I've talked about the healthy exercising. As I said, we are in a new year. There are lots of opportunities. You see lots of vouchers around going. You can come register yourself with the gym and all that. If you don't want to register, as I've mentioned before, just do your cycling, just do your walking, just do your swimming, and you will be, as you do that, it will help your body to also exercise. So these are the preventions of heart attack. So listeners and viewers, as I mentioned, heart attack is a very serious health condition, and it's one of the life-threatening health emergencies which you need when you or your loved ones is experiencing any of the symptoms I've mentioned. Please don't waste time. Call 999, ask for ambulance, and immediately say heart attack, and help will be given. If you think you driving your loved one to the hospital is the quickest, do so, because time is essential when time is essential when it comes to heart attack. So, ladies and gentlemen, thank you so much for this information, for listening to what I have for you today. And I'm so excited to have my co-host on the line. For listening to what I have for you today, and I'm so excited to have my co-host on the line, Gladys. So I will try to invite Gladys on the line, who is going to say something small to our viewers as we started this new year. Hello, Gladys. I hope you can hear me.
Yes, Emma, I can hear you. Thank you for having me. Well done. What wonderful messages you've sent to us. Thank you for having me. Well done. What wonderful messages you've sent to us. But the little I was saying, what I say to start the new year, more topics, exciting ones. We'll be sharing with people. And also, the new year has come and we're making resolutions. Let's make one for our health. Just like Amma has said, let's keep our health as the priority, as health is wealth and wealth is health. Thank you, Amma. Well done.
Yeah. Yeah, hello, Gladys. Yeah.
Hi.
Yeah.
Yeah,
Yeah,
I'm
hello,
done. Thank
Gladys.
you.
Yeah. Hi. Yeah. Yeah, I'm done. Thank you. Yeah, thank you, Gladys, for joining us. And hopefully, I will see you on next week on one of our programs. Hopefully, I will see you on next week on one of our programs. Hopefully, I will see you on next week on one of our programs.